Good morning. Good morning, everyone. Please make your way to your seats. The ceremony will begin shortly. We're so excited that you are here today to celebrate our wonderful graduates. This is a joyous day and a momentous achievement for our students, their families and friends, and the whole School of Public Health community. While today is a day of celebration, we recognize that world events have challenged campuses worldwide. And this academic year in particular has been difficult and painful for many members of our campus community. A core value of our institution is respect for diverse ideas and viewpoints, even those that some may find uncomfortable or disagreeable, you all know. Graduation events like this one often see many forms of disruption, good forms, cheering, shouting, noisemakers, and this year we may see some organized activism and protests. It's important to remember that the protesters are typically our students or other members of the university community, and they have rights and privileges afforded by the university's policy on freedom of speech and expression. So while our campus community is accustomed to activism and disruption, we acknowledge that not everybody is. So if a disruption occurs during the graduation ceremony, you can help by just remaining calm and seated. We have an established protocol, and we ask everyone in attendance, that's graduates, guests, staff, and faculty, to just be patient. Let the plan unfold. Please don't engage with the protesters during the ceremony, whether you strongly agree or disagree, so we can keep our focus on the graduation and celebrating our graduates. We're so happy that you're here today celebrating our graduates, and we appreciate your patience and understanding in case there's a disruption. So now I ask for you to join me in welcoming one of our great graduates, Allison Baumgartner, to kick off today's ceremony. Go Blue.
Good morning, School of Public Health administration, faculty, staff, alumni, esteemed guests, and the graduation of the graduating class of 2025. Today is a milestone in academic and professional journeys. We're here to celebrate the hard work and achievements of our graduating class. My name is Allison Baumgartner, and I'm a graduating MPH in Global Health Epidemiology. As the president of the Public Health Student Assembly this year, I've witnessed the mosaic of passionate student initiatives, highlighting the unwavering determination that defines our community. To the students, your journey deserves recognition, celebrating the immense efforts and hard work that brought you to this moment. Your work advancing methodologies and modeling, educational initiatives, nutritional counseling, healthcare policy, and educational and environmental reform underscores your potential. On behalf of the graduating class of 2025, I'm honored to welcome you all to the University of Michigan School of Public Health graduation ceremony. Before we begin, we have a few housekeeping notes for you. The platform party processional will begin in a few moments, so we ask everyone to take their seat. During the processional, graduate recognition, and the platform recessional, we ask that all graduates stay in their seats as we will use all the aisles. Guests cannot come down to the stage at any time, and flash photography is prohibited. At the ceremony's conclusion, the ushers will release graduates and allow them to use the exits in the back and the entrances to meet their guests outside on Ingalls Mall. Following the party recessional, we ask that guests leave the auditorium as quickly as possible, as another ceremony is happening here later today. Public health is fundamentally built on relationships. and a shared commitment to ensuring that everyone in every community has the opportunity for a long and healthy life. It means first listening and working alongside community members, understanding different viewpoints and concerns, and meeting members where they are. It means being present with the person sitting across from you. Here at the University of Michigan School of Public Health, I've had the immense pleasure of being present, listening, and learning from my peers, faculty, and staff. I've witnessed students grow as leaders, finding their voice in advancing research and advocacy across various initiatives and projects. I've witnessed peers excel in complex topics and enjoy the process. I've witnessed colleagues remain resilient and succeed despite the immense challenges or obstacles. The road to success is rarely a straight line. Success often requires adaptation in the face of obstacles. In public health, we often run marathon relays rather than the short solo sprints. We all make up critical parts of a team with our unique strengths to ensure we all go the distance and succeed together. Friends, I'm not naive about the environment that we are entering. Yet your hard work, determination, resiliency in the classroom have prepared you for this next road ahead. Driven by science and radical compassion, now is the time to seek community. Listen to understand, be creative, and remain committed to a healthier world for all. I encourage you to take what you have learned and apply it boldly to the challenges ahead. Looking around this room today gives me hope for public health. Each of our graduates embodies the brilliance and dedication needed during this time. Today, we have abundant reasons for joy and hope, and tomorrow, we have work to do. Congratulations to the class of 2025. Thank you, and go Blue.
Good morning, everyone. Can I ask the faculty to please be seated? I am absolutely thrilled to be here with you today to celebrate the class of 2025. For our guests here, I am Du Bois Bowman, and it is my privilege to serve as Dean of the University of Michigan School of Public Health. I am also a proud alumnus of the school, having earned my degree, my master's degree in biostatistics in what still seems like just a few years ago. So graduates, today I'm here not only as your dean, but I'm also here as someone who's walked a similar path as you and remembers the exciting road that lies ahead. Today we are celebrating 450 graduates. And to our graduates, after graduation, you will fan out across the globe, taking on critical roles in healthcare systems, in government agencies, in the private sector, and on the front lines of public health practice, among many other areas. As I've navigated my own career after graduation, I've also had the pleasure of witnessing my Michigan public health classmates evolve into public health leaders around the world. And graduates, I know that the same is in store for all of you. You each have something important and valuable to offer the world, and we are all cheering you on. You're entering the field of public health at an incredibly important time. Those of us in public health work on some of society's most pressing issues such as gun violence, issues such as environmental justice, advancing health equity, fighting infectious diseases, and so much more. We also find ourselves in a moment where many of these very issues are under threat, particularly with respect to federal funding, which is absolutely crucial to our ability to advance solutions. Targeted actions weakening public health may feel daunting or even discouraging. But as I look out into the graduating class, those are not my sentiments at all. I feel hope. I feel inspiration. I see a group of students who have committed themselves to dismantling health disparities. I see students who have chosen to pursue bold and courageous scholarship, even when doing so might be difficult. I see students who remain focused on partnering with and supporting communities in need. I see students who have stayed true to our mission at Michigan Public Health to pursue a healthier, more equitable world for all. Students, our future is brighter because of all of you. Many of you may be uncertain about what the future holds. In fact, leading up to the ceremony and my conversations with many people, I will often ask, what's next? And if you feel a sense of pressure by reflecting on what's next, I want to tell you a secret. Everyone in here has felt that at some point in time. But be assured that you have the skills, you have the education, you have the talent to determine your path. I encourage you to seek opportunities that excite you, that challenge you, to try to find places where you can work to truly make a difference, and to pursue experiences that allow you to continue to grow. Trust yourself to know what is right for you and to know what isn't. Don't be afraid to change directions or to seek new opportunities. You each have what it takes to succeed. Give yourself time, compassion, and grace as you navigate the infinite possibilities that lie ahead. We all believe in you. We all hope that you're leaving with memories of achievements and good times together and lifetime connections with your classmates. But we've also known that you've experienced some challenges along the way. Through those challenges, you've demonstrated your resolve, and despite these challenges, you have made it. So let's pause and give yourselves a round of applause. That is what we are really here celebrating today. It's your grit, it's your determination, your perseverance, your tenacity in completing this step of your educational journey. We are a field that's built on a foundation of hope and optimism. That is the fundamental belief that we can and will change the world for the better. My wish is that you move into the next stage of your journey wrapped in this hope and optimism for the future, but also anchored by your determination and will to persevere. We are so proud that you will be representing the University of Michigan School of Public Health in all of your future endeavors. I want each of you to take some time, whether it's today, whether it's over the weekend or in the weeks to come, take some time to pause and reflect and truly celebrate what you've achieved. And that, again, deserves a huge round of applause. And graduates, while you sit here today during this really proud moment, I trust that each of you knows that you didn't get here alone. Pursuing your education takes a village, and you can look around today and see some of the people who make up yours, your family, your friends, your classmates, your faculty, and your staff. I'd like to take a moment to recognize the many people who've played an important part in your journey. First, thank you to the faculty for delivering an outstanding Michigan quality education to our graduates while also mentoring and developing them. Also, our work would not be possible without the support of our staff and student employees who keep our school moving forward every day. And then I also want to express my gratitude to everyone who traveled here today to participate in this ceremony and to celebrate our graduates, as well as family and friends who, for whatever reasons, can't be here, but are with you here in spirit. So let's give a round of applause to them. Now I'm thrilled to introduce our next speaker. Each year, a student is selected to speak at our ceremony on behalf of the entire graduating class. And this year, I'm pleased to share that Irving Suarez, a Master of Public Health student in the Department of Health Behavior and Health Equity, will be delivering the address. So, Irving, welcome to the podium.
Thank you, Dean Bowman. Kaserian Ingera. Kaserian Ingera. 5 years ago, I found myself in Tanzania for a semester abroad as an undergrad student in a small village in the Mara region, where I spent most of my time volunteering at a local clinic. Now, when I talk about my time in Tanzania, I talk about camping in the Serengeti. The heat, the daladalas, the chapati and chai I often had for breakfast. But what sticks with me the most is a simple phrase, Kaserian Ingera. The first time I heard the phrase, I was probably sitting around, sipping a Coke, listening with locals, listening to their stories. Kaserian Ingera. I didn't know what it meant, but everyone said it. It felt important. I managed to scribble this phrase down so I could translate it later. Kaserian Ingera. What this phrase means is, and how are the children? And how are the children? Now, the response to this initial greeting, or at least what one hopes to hear, is Supati Ingera, the children are well. It's a simple response, but it's a handful of words that illustrates the Maasai tribe's greatest priority, the children. It means that as a community, as a collective, decisions have been made to ensure the safety of the vulnerable. Today, I'm in front of this community, our public health community. It includes my sister and my favorite cousin, my parents and my loved ones, and all of you, my fellow graduates. Now, I wish I could come up here and ask with hope, Kaserian Ingera, how are the children? Oh. But to ask that question with hope would mean knowing that we have done everything in our power to care for the children. It would mean trusting that every decision made was guided by a commitment that ensures that children are well, that the vulnerable are safe, and that the future we are shaping is secure. But today I cannot ask that question with hope. At this very moment, the children are not well, the vulnerable are not well, the future we are shaping is not well. Maybe it's because we're too busy sitting around, writing papers, talking about the lessons learned, debating issues from every possible angle. But our responsibility is not to hide behind our research. Our responsibility is to act. Our responsibility is to consider the well-being of the innocent. Now, there are those in this country who tolerate a world where children grow hungrier, a world where children sleep beneath rubble, who deny trans youth access to care but let bullets ravage classrooms, who let immigration policies fracture families, stripping away the support systems that once offered stability. Now, there are also those who bend the knee and preemptively obey, failing to put up a fight. Do not misunderstand me. It is an honor to be standing up here today, dressed in this robe and tassel, to look into the crowd and see hundreds of my peers. Today is a day to celebrate our accomplishments, to reminisce on those moments where we questioned if it was worth it, if we were cut out for this, if we could make it. Today we can answer those questions and say, was worth it, we are cut out for this, and we did make it. Those moments of doubt and perseverance were just obstacles to overcome. They were lessons in resilience, creativity, and collaboration, lessons that have prepared us for the work ahead. Today we are public health professionals, and our responsibility is to be proactive, promotive, protective. Now, my fellow graduates, as we step into the future, there are many guiding questions to consider. How do we center diversity for future public health students? How do we establish equity for the vulnerable? How do we ensure inclusion and building healthier futures? But I believe the essence of these questions can be found in a simple yet lasting phrase, "Que hacer en Higuera, how are the children?" Let it serve as our guiding question, our guiding principle, a reminder that the measure of our success is not just in our achievements, but in the well-being of the children, the well-being of the vulnerable, and the well-being of the future generations who will inherit the world we shape. Now, I want to encourage all of you to take a moment and think about the children in your lives. Think about those who are vulnerable and ask yourself, how are they doing? For me, when I think about the children in my life, I think of my 16-year-old sister. And as I stand up here today, I want to take this moment to speak directly to you, Katia. I could tell you that the world is unfair, that life is hard. I could apologize and tell you to accept our current reality. But I'm not looking at the past, I'm looking at you, I'm looking at the future, and I want to take this moment to promise you, I will not be the kind of person who bends a knee. I will be relentless, and I will do my part so that the world you inherit is a world that lets you be bold and live freely, a world that honors your potential and allows for your future, for your dreams to become true. But this promise is not mine alone to keep. It belongs to all of us gathered in this community, a community that carries the same responsibility to the children in their lives, to the vulnerable who rely on us to care for them. Today is a celebration, but it is also a promise. A promise to be the kind of professionals, the kind of community that can proudly say, Supati Ingera, all of the children are well. Thank you. Go Blue.
Irving, thank you so much for your remarks. I hope for all of our guests joining us today that gives you a glimpse of the kind of students we attract at Michigan Public Health and the kind that have enriched the learning classes of the loved ones who you are here to support. And to our graduates, often graduations are called commencements. So as we stand here today, marking an incredible achievement, I think Irving has given us a challenge as we commit to the next stage, something that can serve as a guiding post for years to come. Now it is my distinct honor to introduce our commencement speaker, Chris Sarri. Chris is an Ann Arbor native and an alum of Michigan Public Health. And in fact, just last night at dinner, I am an Ann Arbor native and an alum from Michigan Public Health, and we learned that we were in high school at the same time at Pioneer High School here in Ann Arbor. Go Pi High. And we overlapped here at Michigan Public Health. Chris has a deep passion for the natural world and a commitment to public service. She's driven by a strong belief in engaging diverse stakeholders in policymaking and finding innovative solutions to environmental and development challenges. Chris's career spans more than 3 decades working on environmental policy to improve the livelihood of communities and to protect nature. She most recently served at the U.S. Agency for International Development as a senior advisor for climate and environment in the Bureau for Resilience, Environment, and Food Security, and as acting chief climate officer. In 2024, President Joe Biden nominated her to serve as the Assistant Secretary of State for Oceans and International Environmental and Scientific Affairs. I'm thrilled to have her here with us today to address our graduates. Please join me in welcoming Chris Sarri.
Good morning, everyone. It is such a pleasure to be here. So first, I want to say congratulations, class of 2025. I was going to I'll end my speech with some advice for everyone, but I decided after following these 2 speakers, I wanted to offer it at the very beginning. In your career, should you ever be asked to give a speech, try to go first so you don't have to follow 2 amazing speakers. So it's a tremendous honor to stand before you as you mark this pivotal milestone in your lives and careers. Almost 30 years ago, I sat where you are now. I was ready to be done with classes, with late night study sessions, and endless papers. Like you, I was ready for the real world. I was ready to make my mark, create some waves, and honestly, start earning a paycheck that didn't come with the words assistant attached. I didn't have a job lined up, and I desperately wanted to stay in Michigan. But landing a community development or environmental position back then was kind of as easy as finding a parking spot on a Michigan football Saturday. And my future? Well, my future is a little bit like the weather that was outside in Ann Arbor in April. Sunny one day, sleet the next. So if you're feeling a little unsure, that's okay. So I received a piece of advice, and it was disguised as a very simple question. What is your North Star? And it made me hit me that I didn't get these degrees to frame them and put them up on a wall. My graduation wasn't the mountaintop. It was just merely base camp. And I just needed to start walking with my eyes fixed on that guiding light. So someone who has spent decades working at the interface of policy, the environment, public health, I can tell you that the path you have chosen is not just a career, it's a calling. And it is a calling that we need now more than ever. When people look at my resume, there's often this time where they do this double take that I have an MPH on my resume. If you look at me on paper, I look like that classic DC policy wonk who can go to a fundraising dinner and know what fork to use, basically. But let me tell you a little bit why I pursued the degrees I did. I pursued my master's in natural resources because I love nature, and I believe we have to protect the planet both for nature and people. But I pursued my public health degree because of the skills it's teaching me, which was systems thinking and equity. And I swear to God, these are skills that will help you crush it at every single job. What it taught me is it taught me how to create policies that work for people, and how to be sure that programs deliver results, and even how to use behavioral theory, believe it or not, in negotiating. Honestly, public health gives you some of the most versatile skills. It can literally take you anywhere. And I mean, just look at my journey from redeveloping brownfields in Detroit to directing the Office of Management and Budget's Legislative Affairs shop. And you will learn that budgets really do tell the priorities of a nation. So public health is critical work, but it isn't glamorous. Hate to break it to you. There probably won't be any red carpets or celebrity endorsements in your future. In fact, when public health professionals do their jobs perfectly, nothing happens. There's no outbreaks, there's no crisis, there's no headlines. The greatest successes in our field are often invisible. They're the disasters that never occurred, the lives saved without fanfare, the suffering prevented before it began. It is this invisibility that makes your work important. Each of you represents the next generation of defenders in a fight for health equity. As students, you learned about the complex forces that shape human health, both locally and globally. You mastered epidemiology, you mastered biostatistics, environmental health frameworks, behavioral theories, and cost-effective health delivery models. But I hope you also discovered something equally important: your North Star that is going to guide you through the political, social, and ethical challenges ahead. What I learned about public health is it is inherently political. It's not partisan, but it is political, because your work will inevitably intersect with policy decisions, budget allocations, and competing societal priorities. You'll find yourself explaining complex public health concepts to policymakers with different agendas and community members with different concerns. I acknowledge you're graduating at a challenging moment. This university and others are stepping back from diversity, equity, and inclusion initiatives. You may feel angry, you may feel disappointed or concerned about what this means for the future of public health, which has equity at its core. And now, at the federal level, we're seeing significant restructuring of agencies, we're seeing staffing and budget cuts, and we're seeing policy decisions that will impact the public health landscape that you're about to enter. So I think I want you to remember two really essential things. First, the values of diversity, equity, and inclusion are not institutional programs. They're fundamental principles for effective public health practice. So no matter what happens at a policy level, you carry these principles with you in the evidence-based understanding that health disparities are real, that social determinants matter, and that public health must reach all communities. Second, as federal programs change, state and local governments are going to need your skills more than ever. The nonprofit sector will also step up, and the private sector will seek your skills as it increasingly recognizes how important population health is to their bottom line. So I encourage you to be flexible and creative. The skills you've developed here are transferable across sectors. And remember, sometimes these times of disruption often create space for innovation and entrepreneurship. In these moments of institutional and political flux, remember your public health training. Remember that evidence matters, that methodology matters, that rigor matters. And remember that relationships matter, that trust matters, and that respect matters. These skills, communicating complex concepts, building trust across differences, collaborating with diverse stakeholders, will serve you well regardless of the political climate. You understand that public health requires systems thinking, seeing the connection between water quality and childhood development, between housing and maternal health, between transportation and access to care. This integrative perspective, it's your superpower. And in a world where we have too many silos, use it to your advantage. Your work is also going to require courage. It's going to be the courage to advocate for health equity, even when institutional support wavers, the courage to stand firm in your commitment to reach underserved populations, even when political winds shift, and the courage to build coalitions across ideological divides when necessary. And coming from Washington, D.C., we need those coalitions now more than we ever have. So the challenges facing public health cannot wait for perfect political conditions. They will demand action now from professionals like you who will understand that public health transcends partisan divides. So during my career, I've obviously witnessed multiple shifts in political landscapes that affect conservation, environment, public health. And what I've learned is that the professionals who thrive are those that can adapt without compromising their core values, who can find common ground without abandoning scientific integrity, and who can translate their experience into language that resonates across political perspectives. What I can say is the work ahead won't always be easy, but it will always matter. And decades from now, when you look back at your careers, you might not be able to count all the lives you've saved or improved, but you will know with certainty that the path you chose was worth taking. So as I mentioned, being a good public health practitioner, I took a survey, and every so often I do that. So I wanted to offer some words of advice from the class of 1996 to you. So a couple of things they really wanted me to point out. First of all, public health is a helping profession, but you cannot effectively care for others if you don't care for yourself. So self-care isn't selfish, it's the foundation of sustainable practice. Okay, remember, this too shall pass. It may pass like a kidney stone, but it will pass. These challenging times, the funding uncertainties, they won't last. Your career will span also multiple administrations and policy shifts. Focus on that North Star, keep walking, keep climbing, always play the long game. Public health work is collective. We're addressing enormous challenges that can't be solved alone. Work together, bring in diverse perspectives. This isn't a competition. It's about how can we collectively address society's most pressing challenges. Do small things well. You may start with what seems like a minor role. Do it exceptionally. I've seen people shine in one small task, and it has led to much greater opportunities. Be open to unexpected paths and unconventional collaborations, because the best opportunities often come when you least expect them. And understanding those different perspectives can enrich how change happens. Lead, follow, or get out of the way. As public health professionals, you're sometimes going to need to be very good team members. Occasionally, the best service you're going to be able to offer is to just step aside for others. But often, especially in times like these, you're going to find yourself in leadership roles. With your knowledge, you need to be ready to lead, to stand up, and yes, even to resist harmful policies for the public's health. When you leave here today, you're not just going to be carrying a degree, but a calling to use your knowledge in service to those who need it most, a calling to speak even when it's difficult, a calling to persevere even when progress seems slow or moving backwards. So one final thing, one person can make a difference in many lives. The impact of public health extends far beyond what conditions can achieve, because we create ripples that eventually touch seas of people. Congratulations, class of 2025. I know the United States and the world will be stronger because of you. So go out there, make us proud, and go blue.
Thank you, Chris, for those inspirational and sage words of wisdom. Graduates, I hope that you've taken account. I almost wanted to pull out my cell phone and take notes, but thank you for that. And now we are transitioning to an exciting part of our program. We get to recognize our first group of graduates. Are you ready? So the program will begin by recognizing the doctoral graduates. So doctoral graduates, please follow the marshals to the stage.
Dean Bowman, on behalf of the faculty of the School of Public Health, it is my pleasure to present the candidates for the Doctor of Philosophy degree. Aubrey Annis, Methods and Applications for Improving Interpretation of Genetic and Genomic Data. Janae Nicole Best, Returning the Cape, Deepening Our Understanding of the Relationship Between Superwoman Schema and Mental Health among Young Black Women Attending a Historically Black College and University. Laura Brotzman, Older Adult Perspectives on Life Expectancy in Cancer Screening Decision-Making, a Mixed Methods Investigation. Morgan Bird, Aging and Health in Skilled Nursing Facilities, Exploring Population Characteristics and the Microbiome. Sai-Chin Cho, Negative Wealth Shocks in Mid to Later Life and Cognitive Aging. Sarah Anter El Azab, a critical analysis of organizational practices underlying interoperability of race and ethnicity data. Arya Grabowski, Pregnancy and Lactation, Sensitive Periods for Maternal and Child Long-Term Health. Ariella Hoffman-Peterson, Innovating with Trust, Regulation and Organizational Field Maturity in the Area of Emerging Health Technologies. Mentong Hu, Privacy-Enhanced Learning and Inference with Distributed Clinical Datasets. Jessica Ibi-Ebele, Examining the Role of Viral Interaction in Household Transmission of Respiratory Viruses. Tomoko Ishikawa, Sex-Specific Effects of Per- and Polyfluoroalkyl Substance and Arsenic Exposures During Early Development on DNA Methylation and Cardiac Function. Amy Jiao, Impact of Private Equity on Healthcare on Medicaid Enrollees. Gabriel Johnson, exploring the relationship between Black masculinity and mental health among Black sexual minority men in Southeast Michigan. Estra Kasai, the role of residential segregation and psychiatric disorders in suicide-related outcomes and mortality among Black Americans. Jennifer Tin-Young Lee, investigating the role of dietary patterns and methyl donor nutrients during critical developmental windows on DNA methylation in adolescence. Zhang Li, statistical methods for integrative genetic and genomic data analysis. Nathaniel Osher, Bayesian spatial models for cancer imaging data. Shannon Park, gestational phthalate exposure in child neurodevelopment and behavior, the roles of maternal inflammation, oxidative stress, and bioactive lipids. Shomik Perkiyasta, statistical methods to investigate an asymmetric association and directionality in biomedical studies. Margaret Robotnik, altered lipid metabolism, a novel mechanism of maternal blood PFAS and preeclampsia pathogenesis. Jila Rajai, exploring spiritual distress and acceptability in chronic disease, state of the literature and perspectives of patients with type 2 diabetes and healthcare chaplain providers. Carmen Ramos, the role of co-parenting dynamics in early childhood feeding and promotion of young children's healthy weight. Kaylee Rumfelt, correlates of protection for IAV, RSV, and SARS-CoV-2. Anupam Tadi, occupational hazard identification and risk assessment for professionals and student researchers. Jelly Tan, Computational and Machine Learning Algorithms, Development for Epidemic Forecasting and Tobacco Research. D. Wang, Integration Methods for Incorporating Published Prediction Models with New Time-to-Event Dataset. Mari Wank, Design and Statistical Methods for Partially Randomized Patient Preference, Sequential Multiple Assignment Randomized Trials. Lauren Ward, Impacts of Per and Polyfluoroalkyl Substance Exposure on Epigenetic Aging and Immune Response in Firefighter and Adolescent Populations. Emma Louise Willoughby, The Politics of Wet Markets, Global Health and Governance in Vietnam. Pei-Jun Wu, Statistical and Computational Methods for High-Dimensional Genetics and Genomics Data. Chang Xu, Statistical and Computational Methods for Polygenic Score-Based Phenotype Prediction. Shui-Xin Yu, Cumulative Loneliness and Memory Aging Among Middle-Aged and Older Men and Women in the United States. Jose Victor Zambrana Madriz, Epidemiology and Immunology of Dengue Virus Infections, Investigating Serotype Distribution, Zika virus influence, and Long-Term Antibody Responses. Luis Zavala Arciniega, Disparities in Flavored Cigarette Use at the Intersection of Multiple Identities and Potential Impact of Banning Flavored Cigarettes in Mexico. Guanghao Zhang, Efficient Sampling Design and Data Harmonization for Electronic Health Records. Bongyao Zhao, Bayesian Machine Learning Methods for Brain-Computer Interface Applications. Mia Zhu.
Dean Bowman, on behalf of the faculty of the School of Public Health, it is my pleasure to present the candidates for the Masters of Public Health degree.
Annabella Dil Gomez. Ivy Chang. Lydia Downey. Madeline Cook. Maya McCormick. Leilani Lattimore. Nia Thomas. Taylor Hall. Maria Barenberg. Michael Royce Tahn. Leah Esther Hibbs. Morgan Hurst. Mia McPherson. Stuart Nowinski. Eduardo Mendez. Jade Hip. Aliyah Patel. Esther Nalugia. Kedriana Cohen. Ayana Bird. Usha Sethuraman. Marina Maunir Bakiat. Kathleen Cole. Leah Griffith. Tasha Phillips Wilson. Jacob Hernandez. Corey Lamb. Diane Zorkot. Colleen Jen. Carol Lee. Isla Salinas Romero. Tina Sassine. Sarah Fye. Frankie Douglas. Riel Sorrell. Jillian Green. Rachel Sexton. Adriana Rochelle. Lauren Hodson. Nicole Jarecki. Richard Slusher. Sharon Castro. Shannon Denise Stone. Maria Renesis. Elise Marucci. Samuel Huizenga. Victoria Wurzel. Madison Butler. Amanda Pata. Dane Collins. Namer Asi. Amira Amir. Jackson Notier. Mahek Bansali. Shayla Eileen Harrison. Sydney Ballin. Ali Sidok. Elizabeth Garcia. Rawan Al-Zalzala. Fahad Hussein Al-Anazi. Daniel King. Madeline Renault. Usman Khan. Maria Katharina Hazelness. Lillian Stein. Hafsa Usman. Noor Saloob. Amani Abolanain. Morgan O'Sayer. Gloria Mashana. Abe Salih. Yike Liu. Malika Balagopal. Shravani Gumaraju. Kashish Mihandirata. Amisha Kaur. Aliyah Dada. Marianne George. Christina Kaiser. Audrey Ruhana. Maggie Wallace. Kiwen Yen. Wenxin Yin. Octavia Zhao. Bessie Wong. Juan Rocho. Teddy Bellman. Lindsay Miracle. Caitlin Ravenker. Christy Yasmin Rivera. Veronica Damik Valvano. Jillian Foos. Sarah Murata. Navreet Singh. Padmaji Rachel Zumberg. Zanab Manzoor. Isabel Gilbertson. Reagan Shalau. Stefan Jose Manuel Cabrera. Thomas Joseph White. Joseph Ciarelli. Naheem Mia. Allison Baumgartner. Janae Jones. Ariana Stringfellow. Russell Francis. Josephine Linden Sires. Taylor Whitting. Timothy Rhodes. Julia Blake. Marissa London. Mengni Jing. Q An Fan. Lisa Ko. Shad Austin Soldano. Shadi Mawari. Zehua Zhao. Giselle King. Cassidy Hoke. Bridget Nelson. Ishita Shukla. Christina Ahrens. Greta Rempel Fisher. Mary Catherine Byron. Hannah Rice. Samantha Lilly. Hope Parker. Logan Tillman. Jessica McCoy. Batul Ali. Skylar Purse. Natalie Cripps. Haley Weiss. Jihana Mendu. Brittany Gilchrist. Kathleen Romas. Ashley Van Winkle. Marina Lini Gupta. Robert London. Rosalind Schaefer. Laura Duffield. London Kozlowski. Maura McPherson. Mark Hachicho. Zach Heiler. Ty Isabella Fernari. Haley Tursak. Emily Anderson. Amber Sarah Brewer. Zoe Liu. Reagan Young. Megan Rose Major. Haley Johnston. Amelia Mitchell. Lily Tiefel. James Saleh. Hossein Mohammed Arman. Skylar Rogers. Anna Paulo. Molly Solomon. Alexis Paolucci. Ellen Beach. Sydney Gurecki. Caitlin Bowie. Nikita Makamala. Ederinola Omolade Adunbi. Irving Suarez. Nima Hassan. Miriam Gondom. Keith Hudson. Yiga Zhang. Yushu Zhang. Yuchen Zhang. Montserrat Yamas. Jenny Ho. Zong Quan Chen.
Dean Bowman, on behalf of the faculty of the School of Public Health, it is my pleasure to present the candidates for the Masters of Health Services Administration degree.
Yue Zhuang Liu. Andrew Byers. Jacob McCombie. Hannah Miller. Christopher Moy. Filaska Dadu. Kendall Roosevelt. Caitlin Sasaki. Medina Shavich. Smith Patel. Nicholas Gagliardo. Cole Ashton Frederick. Janelle Dibaki. Phoebe Catherine Watson. Kristen Harvey. Amina Kamran Dada. Natasha Gadria. Akash Sanjay Dhruva. Mahalakshmi Sivashankaran. Joanna Huerta. Grace Andrix.
One more.
William Hibbler.
Layla Joffrey.
Rebecca Pantis. Amy Harrison. Noel Moreno. Oriana Diem. Michelle Lenso Hazam. Ali Yunus Rizvi. Matthew Hill.
Kim Ross.
Chad Austin Soldano. Q An Fon.
Dean Bowman, on behalf of the faculty of the School of Public Health, it is my pleasure to present the candidates for the Masters of Science degree.
Yuga Gu. Yue Wu. Wen Yu Zhang. Su Shu. Keishin Guo. Lin Xuan Zhu. Zhang Rui Huang. Mimi Li. Rong Ji. Chen Yao Yu. Ke Xin Li. Yu Xiao Ni. Hong Cao. Ruor Bei. Angela Lee. Zafei Luo. Jia Chi Chen. Ziyue Zhang. Shuaying Zhang. Hao Yi Zheng. Yi Liu. Wei Xianghua. Zihao Han. Rayong Dong. Roxy Hao. Chok Xin Fu. Mio Jinhu. Mary Owusu Bonsu. Sisheng Chen. Suyan O.
One more.
Lillian Roundtree.
C. Li Chao Chen.
Elise Miller. Yiren Ho. Xin Yu Zhang. Xinwei Wang. Nayan Deng. Beiqin Ye. Xiang Li. Xiaomeng Xu. Zixin Li. Xinran Xu. Carly Miller. Sachi Sarda. Yuhan Gung. Chen Xing Liao.
Madeline Jones.
Ethan Werner. Nathan Zito. Kirill Sabatov. Jacob Vittergar. William Tackett. Nathan Alexander Hemingway. Walter Williamson. Seth Corbridge. Yi Junzu. Junki Ren. Jing Yi Tan. Chigozia Agwansha. Andrew Huber.
Chen Shi Zhu.
Amanda Schlechte. Rachel Garabedian. Wenfei Mao. Leon Cheng Lu. Xiaolong Wang. Zibo Yu. Yue Yu. Gang Yin Hong.
Ricky Zhang.
Zhou Chur Ni. Xing Xing Zhang. Yuza Ren. Yimeng Zheng. Bingkong Li.
Fatima Khan.
Dean Bowman, on behalf of the faculty of the School of Public Health, it is my pleasure to present the candidates for the Masters of Health Informatics degree.
Qirong Wang. Jay Shu.
Dean Bowman, on behalf of the faculty of the School of Public Health, it is my great pleasure to present the candidates for the Bachelor of Arts and Bachelor of Science degrees.
Lydia Voorhees. Sonia Srivastava. Katie Crone. Hannah Stovall. Megan Van Drager. Dahlia Cohen. Samantha Reardon. Mallory Stabile. Annie Murphy. Lily Stevens. Arush Goel. Mohammed Sheikh Khalil. Hong Deb. Vyomesh Patel. Divil Middle. Ryan Sangmin So. Dev Patel. Rachel Simmons. Inika Gajra. Alexandra Madison Kahn. Julia Ginter-Berryman. Isabella Volkers. Zara Badella. Tanvi Malia. Prema Emadi Seti. Omar Chowdhury. Adarsh Ganapathy Barki. Karen Koo. Kieran Conlon. Emily Endo. Annalise Julia Rowe. Simran Radha Patel. Avery Schultz. Lauren Haynes. Vivian Kaufman. Bhavna Yalavarthi. Sarah Boki. Akil Paleru. Olivia Lee. Sydney Hastings Wilkins. Sarah Kabbalah. Shakira Lorraine Woods. Ryder James Stein.
Mo'men Shakur.
Malia Elizabeth Rubeli. Fiona Cloud Hickey. Vivian Janicki. Madeline Losi. Coda Sturgeon. Ainsley Mulder. Jillian Dana Saxner. Marley Isabel Saxner. Caden Mattingly. Alexis Contreras. Rose Adler. Michael McGee. Sadia Islam. Reem Kalawi. Jalen Smith. April Hamilton. Peace Odiase. Jessica Shu. Andrea Huang. Emily Perez. Anna Kim. Hannah Bedner. Sophie Branham. Isabella Charfuz. Sasha Shrestha. Isha Acharya. Eliza Shearing. Jane Haystack. Sahana Raja. Ritika Tiwari. Sahana Nantigama. Parvati Nagapawa. Reno Fujimoto. Alexandria Smith. Elisa Zen James Canatoy Caldito. Stephanie Janelle. Ellen Durr. Lorelei Conan. Arun Rushton. Stephen Mangold. Michaela Morse. Elia Lester. S.D. Moss. Rihanna Urquhart. Sarah Slan. Daphne Kaplan. Samantha Rich. Julia Agnostic. Dwayne White. Masui. Isabel Duong. Aruvel Rajeswaran. Deborah Marip. Noelia Dulo. Hannah Sullivan. Ahimsa Satyakumar. Amayal Kogalan. Albert Shim. Ala Alawamle. Mohsen Najjar. Dalia Lena Karimi. Sarah Ibrahim Krizat. Sabrina Youssef. Catherine Huang. Leah Page Nielsen. Rebecca Pulliam.
Wow, how wonderful it is to celebrate 450 graduates. Congratulations again. What a joyous occasion. So graduates, your time has come. Before we conclude, I want to let everyone know that you're invited to join us in a reception. I have not checked the weather since I've been on the stage, but hopefully weather permits. There is a tented area in Ingalls Mall, which is just to my left. So as you exit the doors, please turn left and join us for a reception. And then also a gentle reminder to please stay seated and allow the faculty to process out of the auditorium first before then all students and guests leave behind them. So graduates, as you leave, I do want to leave you with a few final words that I hope will resonate and that you'll carry with you. And some, our graduation speaker, Chris Sarri, touched on. The first thing, remain compassionate. In public health, we do our work out of concern for the well-being of people. So always keep people centered at what you do. Number two, remember that public health is a team sport. Build a strong coalition and meaningful connections with the communities that you're serving. And then as alum, also please stay connected with us at the school so that we can continue to celebrate your work as you begin the next chapter of your lives. Number three, and the final point, because I recognize you're graduates now, always keep going. Always keep going. The road can sometimes be bumpy, but public health is an active term and there's no finish line for us. Our work is truly a lifetime commitment. So graduates, on behalf of all of us, faculty, staff, students, alumni, and all of those who have come to support you, we are so profoundly proud of all of you. We're rooting for you. You will forever be a member of the Michigan Public Health family. So graduates, students, I invite you to now rise as graduates. We're going to leave by punctuating this ceremony with a resounding "Go Blue" on the count of three. I want everybody to hear it in Ingalls Mall. Congratulations, and as always, 1, 2, 3. Go Blue!